Well, February, we focus on heart health. We're going to focus on women's heart health when it comes to menopause. Joining us today, she is the Director of Weight Management and Women's Health Services. We have Joyce Boschnick, and thanks for coming today.
Thanks for having me, Holly.
Okay, so what is it with women and menopause and the estrogen that it affects heart health?
So estrogen is protective for your heart. When we enter menopause, the estrogen levels start to decline, and that can lead to increased cholesterol levels, fatty buildup within our blood vessels. So our blood vessels can become narrower, a little stiffer, a little thicker. You can have an increased risk for developing cardiovascular disease.
Well, you know, when you think of menopause, you're thinking of the hot flashes and all those things. So you need to think about heart health too. So are there symptoms, or like what do you do when you talk to your doctor about menopause?
I think you really need to know your numbers. You know, what's your blood pressure doing? What are your blood glucose levels? It gets harder for our body to react to blood glucose changes. That leads to a fat accumulation around your waist. If you start to see these changes, you need to go talk to your physician.
And that's kind of key, making sure you talk to your doctor about this kind of stuff?
Absolutely. You want to go to somebody that you feel comfortable with sharing symptoms. A lot of times we start experiencing these symptoms and we feel embarrassed about them, but it's very normal. And if you don't feel like you're being heard or you're being rushed through a visit, find another provider, because it's so important to feel supported during this time.
So are there any like lifestyle changes that we can do, you know, to help with our heart health during menopause?
Absolutely. Diet. Decrease your salt intake, your saturated fat, physical exercise, and that includes strength training. You want to aim for 150 minutes a week. Also make sure you're getting adequate sleep and know your numbers. Know what your blood sugar level is. Know what your blood pressure is and your body mass index, your weight.
Mm-hmm. I know everyone has stress, but sometimes I feel like women have a little bit more stress. So does that affect, you know, the menopause and the heart health too?
It does. During menopause, we tend to worry more, feel more anxiety, and experience depression. Depression during menopause has been linked to you being at higher risk for cardiovascular disease. So you might want to try some therapies of, you know, yoga, meditation, journaling, maybe massage, aromatherapy, things like that, to decrease stress and anxiety. Mm-hmm. It's just not as easy for things to roll off our back like it was before during menopause.
Is there other kind of support and things that we could do, like when we're in menopause and, you know, going through all this?
Absolutely. You need to have that annual wellness visit with your primary care physician. If you're experiencing symptoms of menopause, discuss those with your gynecologist. See if hormone therapy replacement is an option for you. But most importantly, if you feel like you're being rushed or dismissed, find another healthcare provider so you feel supported.
Wow. All right. Good stuff to know about your heart health during menopause. Joyce, thanks for coming today.
Thanks, Holly.
All right. Don't go away. First Edition continues in a moment.